Hello, I'm Dr. Paul Homily, and I'm pleased to be part of the EnviroMed design team presenting you with this webcast. EnviroMed is a healthcare office design and consultation firm specializing in sustainable dental and medical office design. I've been coaching in dentistry for over 25 years. I've been in hundreds of dental offices and can immediately tell when I'm visiting an EnviroMed designed office. I'm in one now. The exterior architecture is striking and functional. When I walk in, the reception areas feel inviting. The hallways and lighting give the sense of being in an art gallery, not some dreary dental office. And the operatories? They're smart. Lots of great dentistry flows from them. EnviroMed Design Group, with its award-winning designers, architects, and construction engineers, knows how to build a dental office. My role today is to help you build relationships that lead to patients saying yes to your treatment plans. A lot like what EnviroMed does for the physical structure, I do with the structure of relationships among the patient, the team, and the dentist. Now what follows is a short webcast on the design and structure of the new patient experience. It's targeted to the dentist, offering complex care, including implant dentistry and advanced reconstructive and cosmetic care. Its essential elements are totally applicable to everyday bread and butter dentistry. At the end of the webcast, I'll tell you how you can get more information about making it easy for your patients to say yes. I'll introduce you to a distinction right now. The worldwide approach to the patient, the new patient procedure, is what I call is an inside-out approach. You can see from the diagram here. What an inside-out approach is all about is that the new patient procedures generally start on the inside of the patient's mouth. That is, we perform an examination, then diagnosis, and ultimately give a treatment plan. The focus, the energy, the intensity of the new patient procedure starts on the inside of the patient's mouth. Then, once the patient hears the treatment plan and hears the fee, that's when we discover what's on the outside of the patient's mouth. Typically what's on the outside of the patient's mouth, it's their life, it's their budget, it's their time, it's what they're doing in their family, it's their work schedule. This inside-out approach is typically a worldwide approach we see to the new patient procedures. Now when the patient's case fee, let's say, is $800 or $1,200, these outside the mouth aspects of the patient's life really don't make that much difference for most patients. Again, if the case fee is $1,000, dental insurance is going to pick up half of that case fee. They can put the other portions on a credit card or even use a patient financing service like Care Credit. So when we're dealing with patients whose case fee is relatively modest, this inside-out approach works pretty well. But what if the case fee was $20,000? Or what if the case fee was $30,000? Now, how much do these outside-the-mouth issues get in the way? Well, they get in the way a lot. Now, when the patient's fee is $10,000 or greater, an inside-out approach doesn't work too well. Why? Because those outside-the-mouth issues will get in the way. People have got families. People have got lives. People need to get their house in order, oftentimes, before they can accept a $10,000 treatment plan. So when the case fee is high, I suggest we use what's called an outside-in approach. An outside-in approach is where our energy, our focus, the time that we spend in the initial patient experience is spent understanding what are some of the issues on the outside of the patient's mouth. For example, what's their budget? What's their life like? How busy are they with their work schedule? You see, it's not so much what's going on in the inside of the patient's mouth that will deter them from getting care, but rather what's going on the outside of the patient's mouth. We need to learn, we need to understand, we need to take the time to find out what are these outside-the-mouth distinctions and how we can best deal with them. A good way to think about this inside-out versus outside-in distinction is to consider the residential real estate sale. You and your spouse, you go to a realtor and you ask your realtor, hey, we'd like to buy a new house. What is one of the first things the realtor is going to ask you? Of course, she's going to ask you your price range. Shortly after that, she'll ask you for how much money do you have for a down payment. You see, the price, the down payment for the house, it's not actually in the house, it's outside the house. Next thing the realtor is going to ask you is, what neighborhood would you like to live in? How close do you want to live where you work? You see, a good realtor will decide and help you discover all of the outside the house issues before she begins to show you the house. In the industry of real estate, that's called qualifying the client. You see, that's one thing that we never do in dentistry. We simply try to educate the client. We never try to qualify the client. Now, what if you went to a realtor who was a former dentist and used an inside-out approach to you, the home buyer? You would sit down in front of the realtor, you and your spouse, and you say, we'd like to buy a home. And the realtor would immediately launch into a technical description about the different aspects of the home. He may say to you, well, the most important aspect of the home is its foundation. You know, there's 3 different types of foundations. We have a cement slab, you got a 4-foot crawl space, or a poured full basement. 2 different types of poured basements. We got poured concrete and cement blocks. There's 6 different types of cement blocks and 3 different types of cement block joints. Here, let me show you a photo micrograph of a cement block joint. Now, what would you think? You would think about finding a new realtor. You know why? Because that realtor was getting into so much technical detail with you, he really missed the big picture completely. What's the big picture with the house? Is it suitable? Is it affordable? And will it fit within your lifestyle? We're going to discover those issues that are on the outside of our patient's mouth. How do we determine a patient's budget? How do we find out about a patient's life and their work style? Well, let me introduce to you a dialogue called the advocacy dialogue. The advocacy dialogue is a way for us to understand, a way for us to discover what's going on in the patient's life. Let me show you the advocacy dialogue right now. The advocacy dialogue is a simple dialogue. Let's go over it a few times. I want you to imagine that you've just completed the examination. You've completed the examination, you sit your chair up, now you address the patient. Understand why you're not happy with your lower denture. I see many patients like you, and I know I can help you. What I don't know is whether this is a good time for you. Dentistry of this nature can be surprisingly expensive. It can be time-consuming, and it can interrupt your life, interrupt your work schedule. I know you're very busy with your work and with your family, and we need to figure out when is the best time for you to start care. Do we treat your denture now, or do we do it later, or do we do a little bit over time? Help me understand how your care has to fit into your life. So, the advocacy dialogue is a great dialogue to start a conversation about how the dentistry will fit into the patient's life. Now I've presented the advocacy dialogue as a dialogue that the dentist is having with the patient. The advocacy dialogue can be very easily be presented by a team member or an office manager or a treatment coordinator. The whole idea behind the advocacy dialogue is to develop a culture of advocacy in your dental office. Advocacy is an idea. Advocacy is the experience the patient has when they realize that treatment acceptance is on their terms. This is especially important in the high-fee cases. Let me show you another interesting distinction I'd like for you to think about. Here's a graph that shows the level of fee. I'm showing a level of fee from $1,000 to $10,000. This number could be $50,000 right here. On the vertical axis here, I'm illustrating the impact of a particular entity on case acceptance. Here we have high impact, here we have a low impact. When the case fee is relatively modest, let's say it's less than $4,000, then the impact on raising the patient's dental IQ is quite high. That is, patient education, showing the patients the conditions in their mouth, showing the patient the areas that need additional work. That is illustrating to the patient their problem and you then explaining the processes to fix that problem. That's called raising the patient's dental IQ, and its impact on case acceptance is very high when the case fees are very low. The reason that's true is that when the conditions are minor in the patient's mouth, oftentimes they have no understanding or no disability related to that condition. They may not even know, they may not even be aware that they've got a problem in their mouth. Consequently, educating the patient or raising the patient's dental IQ makes perfect sense, and it has a terrific impact on case acceptance. Now, when the case fee gets to be in the $8,000 to $10,000 to $12,000 range and higher, what happens is that the impact of raising the patient's dental IQ goes down. Why? Because patients with severe conditions are often aware of those conditions. They don't need to be educated. You're totally a edentulous patient walking into your office with a lower denture that's a real problem. They know they've got a problem. They don't need a lot of education on this problem. What these types of patients need is an advocate. These patients need someone who's on their side to help fit their treatment plan into their life. So consequently, the impact of advocacy, that is helping patients fit treatment into their life, is relatively minor when the case complications or the case conditions are minor. However, as the complexity of the case increases and as the fee increases, the role of advocacy increases and the role of dental IQ drops down to be very low. What's critically important about this slide is that you duplicate this. Take this image that you see right here and draw it on a little 3x5 card and keep it on your desk. Keep it in your laboratory area. And when you're about to sit down with the patient and talk to that patient about their care, before you do that, look at the card and ask yourself, is this a patient that needs education or is this a patient that needs an advocate? What I'm suggesting to you here is that we use a situational leadership model when we talk to patients. Some patients require education. Other patients require an advocate in the process, and you need to decide that. And the better that you get at that, the more easily it will be for patients to stay with you. Even in the absence of their ability to say yes to you today, they'll stay in your practice, and when they become ready, they'll choose you. I hope you enjoyed that webcast. If you'd like to take the next steps in making case acceptance more predictable and less stressful, visit my website at paulhomily.com and read all about our workshops, our online resources, and the books and audio programs. I'm especially jazzed up about our newest offering, Yes Online. Yes Online is an 8-part video training program that goes deep into the topic of case presentation and teaches you how to influence patients. Our online curriculum guides you through the initial phone call all the way through the financial conversation. Learn more about Yes Online on my website. You've made a good decision about working with EnviroMed Design Group. They're good people and they do a great job, and I'm pleased to be part of their growth process. Let them help you become more successful. Thanks for listening, and I hope to hear from you soon.